Hey guys, you're welcome to my channel again. We've been a series of pain management, and in this session I want to talk about arthritic pain. In arthritis, what happens is as we grow older, our body's functionality reduces. It means that the way the cells produces certain substances that we need life and functionality does not get as much, doesn't happen as much or as fast as it used to when we're much younger. So what this means is certain parts of the body that are required for movement, require something that you would say in the late term would be like grease or like a lubricant. So for your knees, for example, you have we have a joint around your knees, so it's like the lower bone with your thigh bone meeting together where you have the kneecap. So at that point where it meets, there's supposed to be like a lubricant. In medical term we call it synovial fluid. So that fluid is supposed to be like a lubricant that greases the two bones or the joints together, so that the bones do not have friction when you move. So when people get older, that fluid starts to get reduced because the body do not produce as much as it used to. So when it gets reduced, what it means is friction starts to occur more often. And when friction starts to occur more often, take for example your vehicles, for example. People who have cars, you understand what friction does to parts. It starts to wear and tear. So what it means is synovial fluid is reduced, bone starts to meet, cartilage, tissues, tendons, all of that starts to wear and tear, and that now starts causing pain. So how do you now handle pain in such a case? Yes, NSAID will come into play because that will cause an inflammation if the person does not have an ulcer. What else do you need to do? From how I've explained, you know that replacing that fluid that's not as produced as it should would be also another point. That's where professional consultation comes into place, because a layperson may not understand how the body works or how such a pain arises. They will just feel pain and go for a painkiller because that is what is expected. So now that you've learned that replacing synovial fluid and addressing the pain is a way to manage arthritic pain, you may now want to ask, what are the kind of medications that may likely replace synovial fluid? If you've enjoyed this session, please like, subscribe, share this channel to as many persons as possible, because there's a lot of learning going on here.